we've called this panel in this entire celebration, the journey from resilient healthcare workers to transformative leaders, the balancing act. So we will begin with this panel discussion with our esteemed colleagues and myTRC cohort members, followed by the action learning stories and awards follow. So with the plan really with the panel discussion is that I'm going to be presenting questions and asking two members each to respond to the questions, to offer their ideas, their recommendations and learnings. And then for all of us who are on Zoom, we want to invite you to ask questions or respond to the questions that I've asked of this panel as well. And towards the end, we'll open it up for all of us to respond to these questions. So my first question is going to be for Courtney and Neelam, and I will introduce them shortly after I present the question. So this is primarily about leadership inspiration. In resource-constrained settings, leadership is often observed and forged at the front lines. We know that, we've seen that in action. And it's demonstrated by those who are able to balance operational choices, tough operational choices, with empathy, also managing care and compassion, and deep interest in the work that they're doing. And so we want to anchor that aspect into the personal and try to identify whose example, and Courtney and Neelam, this is for you particular, whose example has shaped or inspired your leadership? And how has that example in particular helped you practically in specific moments when you're making decisions or when things have really felt hard? How has that mattered? So that's the question for you. And while you come on, I'm going to introduce Courtney and Neelam. Courtney Moxley is the Partnerships and Growth Manager at Reach Digital Health. That's a TRC partner. She has been convening multidisciplinary teams over the last 8 or so years to address global health challenges through evidence-based digital platforms. She focuses on building collaborations that translate technology into measurable health impact. Courtney then will be followed by Neelam Dev, who is a myTRC cohort member. Neelam serves as the nursing faculty at the Graphic Era Hill University, and she integrates well-being and leadership into her teaching. Her frontline COVID ICU experience is the one that she refers that fueled her commitment to mental health and safe spaces for young healthcare workers. A disciplined organizer, Neelam is also a national Taekwondo gold medalist. So this going to begin with Courtney and then Neelam. Over to you, Courtney.
Thank you, and thank you for the intro and for having me on the panel. And I'd like to say congrats to all the graduates on your 9-month journey. So I'd like to tell a story in response to Ashish's question. My background is actually in scientific research. I studied conservation before and pivoted to digital health a couple of years ago now, and really have two mentors that I'd like to speak about who have helped to shape me in the space of digital health these days. The first I like to call like the architect. He really helped me to shape a lot of those methodological skills that I came into the workplace with coming out of research. So bringing that structure and process thinking that really helped me to be prepared in situations. So his approach really helped me to come, ready for meetings with the things I wanted to speak about and having an understanding of, different roles and responsibilities. So his emphasis was largely on structure and organization and being prepared. And then more recently, I have taken on a new mentor at work, and his approach has been completely different. And his influence on me has been in a lot more of a relational aspect, and he's helped me to in conversation with people think about what is it that this stakeholder is wanting out of this conversation. How can I bring more empathy into the way that I'm relating with these partners on a call, for example? So I'm bringing two examples of very different mentors in my life, and where that has led me today is I now have a much fuller toolbox of skills to tap into, and in different situations, particularly high stress situations at work, I can now call on different personality aspects that are useful in different moments. So I guess the take-home message from what I'd like to share is leadership is something that's is constantly evolving. We never have a full set of skills at any one point in time, but we can always draw on the people around us and take things into our personalities that will help us to adapt and respond to different moments. So I like that idea of not picking one specific style of leadership, but to pull and draw from people and react in a way that is appropriate for different situations. So I like to take an adaptive approach to leadership, and grateful for those two different styles that have helped me to choose what kind of a leader I want to be. And I believe that can be applied to any setting, whether in a high-stress clinical setting or working behind a computer every day. It's important to draw on all your different experiences and leaders. Thank you.
Thank you, Courtney. And we'll probably come back to you because of your experience working with so many frontline health folks. But towards the end, we'll probably have a couple of follow-up questions. But thank you for sharing. Neelam, over to you.
Yes. So I believe that in my journey, I have learned something from every individual that I met. But if I need to mention any 2 or 3 names here who inspired me a lot in my leadership journey, that would be one. The person I admire a lot from my TL when I was in the clinical area, when I was working in the COVID ICU. So her name is Lakshmi. So I used to call her Lakshmi Didi because she was my team leader when I was working as a ICU staff. Because at that time I was very fresher, just complete my UG and immediately join as a clinical nurse in the ICU. But later on, the medical ICU convert into the COVID ICU. So, but initially we were doing well and the situation was manageable. But after some time, as the mortality rate increase, that our emotional strength or the psychological health, everything starts drop down. And I think at that time she was the one. She always came to me in the changing room also, and she always. Take 5 to 10 minutes to talk to me, and even so many times it so happened that she took a long metro route just to spend another 20 or 30 minutes with me. So she always asked me, okay, what I'm doing after reaching home. Also she used to call me, she used to message me. I think that was the one support system, and I really admire her leadership. At that point I didn't know that okay, I can call it as a leadership quality, but now yes, I can say that she's the one. I really admire her, whatever she did for me, or her leadership style. The second thing, I can mention the name of our coach, Mr. Bhaskar, and one is from my PG faculty, that is Dr. Ratna Prakash. The journey of these 2 people is similar. That is why I'm mentioning their name together here. These 2 people taught me the value of emotional strength, the discipline and responsibility towards one's role, and leadership comes from the inner strength because of life commitment, sense of purpose and goal. Because the incidents I can share here is they both lost someone very important, very close to their life, but after that loss also they continue work towards their goal, towards their purpose, without showing any I can say that they never show that emotional burden or toll on themselves, because in every class or every master class, even that our coach Bhaskar and that Dr. Ratna Prakash shows the same level of commitment, enthusiasm and energy in spite of that their personal role. So through these 2 that incidences, I can say that leadership is not only about guiding others when the situation is easy or the situation is not challenging, but it is also about the staying strong, resilient and dependent even the situation is not favorable. So these 3 people inspire me a lot in this journey.
Thank you, Neelam. I think a few things that jump out immediately in how both of you have spoken, Courtney and you, is that there has been an interest among the people who you've referred to engage with you, to support you, or just be available to you, whether it's the relational part of it or offering you technical input and so on. There is an interest and a relational part, and I think we will pick it up in a short while. But let me switch gears and now move to Kingsley and Rita. And for the rest of us on Zoom, please feel free to write on chat, who do you look up to for practical aspects of leadership and why that seems to be the case, what inspires you. Please do write. So Kingsley and Rita, this next question is going to be about role modeling, as you can see on the slide. The healthcare workers as role models in terms of resilience, care, and also the nature of innovation. So again, this is a very delicate balance. We see, we understand the healthcare workers' well-being as really crucial and very vital for health systems' resilience and stability overall. But we realize also in times of crisis and distress, when multiple systems start to fail or structures start to fail or get disoriented, there are no clear or clean boundaries. You do what you need to do as role models. Sometimes it happens that healthcare workers need to influence the norms. And you're on the front line, so you've got to be able to act. So my question to you is, how can we encourage health workers to continue to lead in a way that prioritizes their own well-being, but also the servant leadership really across communities, the quality of care? How do we find ways of supporting that and be balancing? So I'm going to introduce Kingsley first, and then Rita. So Kingsley Rex Chikaphupha, I hope I'm pronouncing your name appropriately. Please don't mind if I sit up. Kingsley is from the Reach Trust, a public health leader with over 18 years of work experience across Malawi and Sub-Saharan Africa, focusing on advancing community health workers' performance and equity through participatory action research. Formerly, he was the co-chair of Health System Global, the CHW working group, and he champions evidence-driven community-owned strategies for UHC. He will then be followed by Niva Manya Rita from the myTRC cohort from Uganda. Rita is a midwife leader with over 12 years of clinical experience, and she also serves as treasurer of the National Midwives Association of Uganda, where she focuses on the association's sustainability. Rita advocates for safe motherhood, dignified maternal newborn care, and supportive spaces that protect HCW well-being. So we want to welcome you both, but we'll begin with you, Kingsley, and then come to Rita, your inputs. Over to you, Kingsley.
Yeah, thank you so much, Ashish. Firstly, my apologies. Each time I switch on my video, I'm being booted out. So I guess my internet connection is somehow weak. So my apologies. I will not be on the video. Yeah. But yeah, I really like this question because I've worked with health workers in general and decided or preferred to concentrate more on the community health workers. But I really agree with the question where it says, I think, and even in your introduction, Ashish, they are indeed our role models if we talk of resilience, care, and innovation. And I agree with this notion precisely because healthcare workers operate on the front lines of both clinical and community vulnerability. And to sustain their leadership, I think health systems must actively work to protect, I think, their well-being while strengthening their capacity, really. And so I have about 3 or 4 points which I thought I needed to share in qualifying my preamble. Firstly, I think we need to strengthen health systems so that healthcare workers can actually lead. By this, I mean we need to see healthcare leaders and managers designing, the work environments that reduce burnout and moral injury. And these should be not only managed, but also we need to set realistic workloads and staffing levels so that providers can deliver care without chronic crisis mode. But also we need to embed regular well-being assessments. We could do this probably via short surveys, check-ins, We could even embed that into routine supervision and quality improvement cycles, that healthcare workers are working with. That's my first point. And the second one is we still need to continue building their resilience and care and combining these two as shared skills. So I believe governments, organizations can treat resilience and compassionate care as learnable competencies and not just personal traits of the healthcare workers. I have in mind approaches that we could include, probably approaches like the mindfulness, so mindfulness-based psychoeducation and stress management training. I think this could also help healthcare workers recognize and regulate their own stress while they are staying empathetic, towards their patients. We can also create peer groups or wellness circles, where healthcare workers could also share challenges and solutions, reinforcing their identity as caregivers, and I believe as resilient professionals that they are. And when we introduce these small innovations, I think we could strengthen and we could encourage, I think, healthcare workers to provide care. But we could also think, of small innovations like adapting digital tools or redesigning, workflows, which could be recognized as part of their, leadership and not just like extra unpaid work, so to say. And I think, talking of digital tools, adaptation, I am thinking of even creating some structured mechanisms for frontline staff to propose. They could test, they could even scale innovations amongst themselves. We have, terminologies like they call it improvement teams, digital health sandboxes, etc., etc. We can also model leadership, that values their whole person as individuals. Yeah, but also we could link their role modeling to community trust. As we might all be aware that I think healthcare workers' resilience is also showcased when they shape the community perceptions around, trust towards health services in general. So we need also to support healthcare workers. We could introduce community dialogues, where they are consulted, they are actually appreciated, and that, I believe, could also reinforce their leadership because they will be seen and valued, So to cap it all, I believe we need to encourage healthcare workers to keep leading in ways that would prioritize their well-being. I think that's the most important, I think, aspect that we need to consider. Because issues of burnout that I talked about, their mental status, what do we do about their mental health, status when they are providing these services with, the emerging, disasters, pandemics, and all of that. So I believe that is really key. And I think if we do that, they'll provide quality care. Thank you so much.
Thank you, Kingsley. And I would encourage the others on the call itself to, just put your comments to see. Perhaps you can talk about, how do you or the people that you work with, or for those of you who are leaders on the call, you coach or oversee others, how do you help them to balance their personal well-being and the leadership effectiveness? Please do put that there. I'm also interested to hear what Rita has to say, because Rita, you've got so many ideas given your experience with this. How do you suggest we find ways of balancing both these needs of well-being and care and leadership effectiveness? Rita?
Thank you so much, Mr. Ashish, and greetings to everyone on call. Yeah. So many ideas have been shared by my first colleague, but in addition, I think it is very important for the systems to encourage taking breaks and support, health workers to have enough rest. For instance, we've seen health workers who will be sick but will still show up on duty. And for me, that, because they are not being understood, even when they explain that they are not doing well, they will still be told to go and show up on duty. So the system itself, it should not be about the individuals. It should be the healthcare system. It should be supportive of rest, for people to take rest when they are on maternity leave. Of recent, I saw a neighboring country, Kenya, passing up some policy on health workers taking the break when they are on their menstrual period. Something like that is very, very critical, because at the end of the day, health workers are not able to do their best when they are breaking inside. So it is very important that if we are to have, quality of care, then we must also have care for the health workers. It is also important that in our healthcare settings, we integrate mental health support for health workers. And these spaces should be very safe, that the health workers will go to, and, at times when they feel overwhelmed, they can go and, shed off all that stress. But also, team building activities in the workspace are very, very important, that health workers can, use these platforms to rewind and, offload themselves of the stress that they will be carrying. But also, we should encourage a system where we do regular reflection on.
Have we lost you, Rita? Mhm. I'm not sure. I'm not able to hear Rita. Rita, are you able to hear us? If you can, we've lost you. Or lost your audio. Okay, so we can come back to Rita shortly, but yeah, this is immensely useful, the way both Rita, you and Kingsley, you've highlighted some of the specifics of how this balancing could be done, because this is some place we often lose our tilt, or just lose our balance as way, and just this is a slippery slope, either to focus on one or the other, or lose which side. So let me now move to the other question. The next question is about practical effectiveness, and for this, I will go to Divya and Arshi next. We want to focus, Divya and Arshi, on your experience, but also emphasize the lived experience and the real world exposure, given the action learning project that you as the cohort were already involved in. We want to understand what works and what does not, from the lens of your leadership experience, both in your direct work, but also you're working with health workers and health systems, frontline folks. So what is one practice that leaders must preserve to sustain health worker resilience? And one outdated, unhelpful pattern, structure, system, or behavior that needs to be transformed urgently. Right. So let me quickly introduce Divya and Arshi. Quick introduction. So Divya Sivaramakrishnan is also a TRC partner, is part of the Dimagi group. She leads the Global Solutions Service Hub, designing and implementing tech-enabled solutions with government and private partners. She brings a decade of experience across public health, livelihoods, and financial inclusion. Divya is trained in sociology, and she applies human-centered design to strengthen frontline healthcare workers' resilience and mental health. And then she'll be followed by Dr. Arshi Ahad. She's from the myTRC cohort, dentist turned public health professional aiming to influence large-scale, equitable health programs and policy. She advocates for preventive approaches to stress and burnout, and for leadership that normalizes mental health literacy in clinical settings. So we're glad both of you are here. Divya, we'll start with you. Over to you.
Thanks, Ashish. Thanks, everyone. It's great to be on this session today. Thanks for having me. And congratulations to all the members for graduating in this beautiful leadership session. So just going over to the question, and having worked with different organizations, I feel like, especially in the development sector, where we're building solutions for community workers, health workers, sometimes there is a constant temptation to optimize from a distance, and to kind of trust the flow that is already in place over what we call as the lived experience. I believe that I think one practice that you know one or a leader must follow most fiercely is to be in a regular, unmediated time with frontline workers. I think nothing really compares to spending time on the field in the community where you really want to develop solutions for. I think without them, there is no value in structured focus groups. We do a lot of, field reports that sometimes are kind of filtered, but actually sitting with a community health worker, let's say in Mozambique or Tamil Nadu or Jharkhand, I think that navigates us towards ensuring that the supply chain is not really breaking, the value chain is not breaking, and so I feel like it's important to spend as much time in the community as we are developing systems and solutions, and actually seeing what they are going through, because I think she's trying to really navigate the entire workflow. The health worker is also trying to work on a mobile app that sometimes can just crash in the community at the time where she's delivering the system and solution, and trying to force the community to kind of trust her. So I feel like when leaders and teams can be closer to ground, there are two things that happen. One, they're able to make better decisions, and two, the workers also feel seen. It feels like they're not the invisible lot trying to be the last mile connector, but I feel like the reality check really helps sometimes. So that's something that I would really encourage us to preserve. I think on the point of removing or really like taking away a redundant step, I feel like, especially in the development sector, there is a particular version of burnout that I feel we don't talk about enough. And we all have worked through, several kinds of systemic changes, design decisions, and so on. And we are also constantly looking at, improving programs through either sitting through tight drum cycles, some impossible timelines for launch, and probably, having a culture where it's, more of a peaks and troughs. So there it feels like I think it's good for organizations like, ours, where we are forcing all of us to be immune to this particular system of ups and downs. I think one different. So just have like focusing on this particular problem statement, and actually having been on the receiving front as well at some point, I feel like making the health workers well-being a metric, and not necessarily something that is an outcome of something. So if the means to an end is also important. So I feel like if the health worker well-being is not measured, then I think there is not much of a management that we can do. And if that is not there, then there is rarely an opportunity for us to think about it. So I feel like it has to be, weaved into the program. It has to be weaved into the way we operate. It has to be weaved into, a daily course of life. So it becomes a priority. And I feel like there are ways in which we can make resilience more structural. And I feel like that is something that we as leaders should start with. Before expecting the systemic change to happen.
Thanks, Divya. I think it just feeds into what Kingsley and Rita was speaking about earlier. But thank you for highlighting that essential, vital, um, really foundation in how we could engage. Can we have Arshi? Are you here with us?
Yeah, I'm here with you,
Go
all.
ahead. Great.
Yeah, thank you. So, yeah, like if I speak from my own experience and what I have observed in the healthcare settings, like one practice which I strongly feel that leaders must preserve is genuine empathetic connection with their team. So, not just, I mean, I don't want something like formal supervision, but real human check-ins. Like, if we ask that, are you okay? And actually we pause to listen. I mean, that really will make a huge difference. Because in healthcare settings, what happened, we are constantly giving to patients, to families, to systems, and often nobody checks on the caregiver. So I have seen that when leaders create a space where health workers feel heard, respected, and safe to express themselves, it literally builds emotional resilience. I mean, of course, it doesn't remove the stress, but it makes the people feel that they are not carrying it alone. So yeah, sometimes resilience is not about being strong individually, but it's about being supported collectively. And I tried my best to follow this practice with my cohort team members when I got the opportunity to lead the team. And at the same time, one outdated practice that really needs to be disrupted is the normalization of burnout, as very rightly Divya also mentioned, because somehow in healthcare, uh, overworking, skipping meals, long shifts, emotional exhaustion, uh, these have been almost glorified, like it just proves dedication. Okay, but honestly, I don't think this burnout should ever be as a commitment. I mean, it's a system failure, honestly speaking, because when we continuously expect the healthcare workers to function beyond their limits, we are not just harming them, but we are actually compromising patient care. Because as Bhaskar sir also mentioned in the comment section, that when we ourselves, when we are deprived, or when we are fatigued, emotionally drained, then we cannot provide the same quality of care as someone who is well supported and well rested. So I feel that it's very important that we should shift uh, from a culture of endurance to a culture of sustainability. Yeah.
Thank you, Arshi. Those are wise words, moving from a culture of endurance to sustainability. We've seen that in other industries. We see that in air traffic or transport. We need to create that space where people aren't so fatigued that they might endanger not just their lives but the lives of people they're caring for. So thank you both of you for highlighting. I'm going to now open up the next question really to everybody. We focused on resilience. We focused on balancing the mental well-being and the leadership effectiveness. I want to now ask you for some specific recommendations, really all six of you, whoever wants to talk about, maybe speak about one specific element targeted at institutions and systems. So to relate resilience and leadership effectiveness within the institution, like many of you have mentioned already, you need to normalize space for health workers to be able to not just do their job, but also recover from stress and trauma and all of that. But there also needs to be space for equitable way of contributing to leadership. Sometimes there are spaces where you cannot really speak or engage. So I want to ask you, from your experience, both as either a healthcare worker or somebody who's working with healthcare workers, what might be one or two priorities that healthcare institutions and systems must cultivate and have, I mean, with the intent of really leveraging healthcare worker leadership. So I'd love to hear what you think. How might institutions take advantage of the work that is being done, the care that is being provided, and the leadership innovations that you see day to day?
Maybe I can start, Kingsley here.
Please go ahead.
Yes, I think for me, one recommendation could be, I think the health system needs to take well-being and the resilience as a system level key performance indicator. I don't think we need to continue treating mental health and burnout as individual issues. I think they must be treated as indicators of system performance. The system should track and act on staff well-being. We can have metrics like stress, turnover, burnout, whatever, alongside the clinical outcomes that we are always focused on, and then we can link these to the leadership accountability. I also think there's need to mandate regular protected check-ins, where I think we ensure that there is adequate rest, there is access to mental health support, and then we can integrate these into job descriptions and supervision, like others have already talked about. Thank you.
That's interesting. Let me maybe bring Courtney back. Courtney, there was one thing that you mentioned earlier was being able to approach a certain number of leaders and ask them to journey with you. I wonder if you could speak about how one can go about identifying someone who you think you admire or appreciate, and then just going and asking them for, just requesting them to journey with you or support you in some way. I think that speaks to how, a person might be able to harness and develop their own capability in a way.
Yeah, that's a great question. And I think having the courage to kind of step out of one's comfort zone and not to find a leader that necessarily backs up your existing skills, but to lean more into an area where you may not be as strong or want to grow into. So, from my personal experience, just, having the courage to try something different, see where you can flex a new muscle and build a new skill set. So having the courage to put up your hand and ask for help in a different way. But I wanted to address this question from a digital health design perspective. And I think as we see AI being built into a lot of healthcare systems and things like that, the solution is not to just come in and enforce all of these innovative digital solutions, but I mentioned this in the chat earlier, is about designing these solutions together with people on the front line, people who are living day to day with the challenges that we're talking about here, and not coming in as these tech people with all the solutions, but rather coming in as a partner and wanting to understand the problem before we bring the solution. So that is my recommendation from a digital health perspective, is to involve healthcare workers not only in the discovery, early design stages, but really throughout the process of bringing in these new solutions to help with efficiency and innovation. And that includes getting their involvement throughout the implementation and the evaluation of them, and then ultimately maybe even into the ownership of these kind of tools that I'm talking about, like AI, for example. So my recommendation is not to just come in as the authority and say, this is the solution that you've been looking for, but how can we help you? How can technology help you? Let's design it together. Thank you.
Thank you, Courtney. Anybody else?
I just want to add a few more points. From my experience, one priority for the institutions, we can actively invest in mentorship within the system. I mean, I don't want something like a culture. I mean, not just a formal programs, but it should be inherited like a culture within the system. Because when people are encouraged to learn from those who they admire, and they grow with guidance, because at the same moment when these healthcare workers when they feel that they are like supported in their journey, so at that moment they won't just perform better, but they can evolve into future leaders like themselves only. I mean, we need to have that cultural setting within the system, not just a formal system, but like a culture being evolved into this mentorship thing.
Yeah, that sounds excellent. Just instead of creating new structure, just create culture, because that's easier to adapt, follow, and for that to percolate across our systems. And so I think at this point I'm going to pause, but I feel it'll be helpful for us to continue the conversation even on chat. I want to take a moment to highlight a couple of takeaways, 2 or 3 takeaways. But while I'm doing that, I'll invite the people on chat to, for those of you who've been responding and asking questions, just even for us to keep moving forward with these discussions, even the idea of doing another cohort, we're happy to, examine how we engage with you all at this point. And if there's any way that we can be of help, please do mention and reach out to the panel if you have any specific questions you want to engage with them, or any specific aspect of leadership that you think has been of interest. So for me, what stood out in this brief conversation was, one, the focus on having someone that you can approach as an emerging leader, as a person who really wants to invest in building your own leadership capacities, focusing on the relational part of it, because that's where the interest really lies. And those sustained engagements can support your lifelong learning and leadership. Beyond, just the technical skills, it's the technical skills and capability, operational decisions, plus having someone who can model good practices in terms of resilience and balance. The other is the fact that during crisis, many of these things fall apart. Behaviors, patterns sometimes can go completely off the edge. So we've got to find ways in which peer support and being able to engage with people on the field, like many of you have already mentioned, that I think will anchor behavior and put that as part of culture more than a checklist or a to-do. And finally, also, there have been enough by way of recommendations of how structures and systems might modify some behavior, some elements that might support the effectiveness of health workers to not just be excellent in the work of caring, but also find ways in which their leadership can come to the fore. So with that, I'm going to thank you, panel, for your reflection, for your provocations, and your practical input.